Now I want to bring in Dr. Ashish Jha, the director of the Global Health Institute at Harvard University. He's been very outspoken about this. First, sort of at the broadest level of abstraction, it strikes me there's two unique challenges the U.S. is facing that no one else quite has faced, which is the contours of American federalism with state and local governments taking different actions and the geographic breadth of the different epicenters in the pandemic, both of which seem more kind of variegated than any other country that's had to encounter it. Well, how do you see that?
Yeah, absolutely. And of course, a third part, Chris, which is we were the slowest off the gate in terms of getting testing going. And so we were behind the eight ball right from the start. By the time this disease really exploded in the U.S., we were way behind. But you're absolutely right. Broad country, lots of big cities, lots of suburban and rural areas, and then federalism, right? And federalism has some upside. So the president has refused to call for a national pause, a national shelter in place, whatever you want to call it. But good news is states can still take a lead. And so there are moments when federalism is helpful, but it turns out, the virus doesn't, respect national borders. It certainly doesn't respect state borders. And so it's very hard to do things when all the states are not synchronized.
Well, what do we know about this? I want to play you Ron DeSantis. He has been very reluctant to kind of shut down business in the state along the lines of what we see in other places, particularly like California. Take a listen.
It would be a very blunt instrument. When you're ordering people to shelter in place, you are consigning a number, probably hundreds of thousands of Floridians to lose their jobs. You're throwing their lives into potential disarray. And if that were something that were necessary statewide because the health comes first, that would be one thing. But if you look at Florida's situation right now, this is not a virus that's impacting every corner of the state.
I guess the question is, how long can that status quo be maintained given what we know about the virus?
Yeah. Look, so first of all, he's right that, a shelter in place is economically disruptive. Let's just own it, right? It's very disruptive. It's hard on people. And that has a lot of consequences. The problem with this virus is that it's insidious. It sort of grows and grows and grows in your community. And then when it becomes apparent, when your ICUs start getting full, boy, it's late in the game. And calling for a shelter in place then is really a problem. So he's wasting enormous amounts of time, and the people who are going to pay for it are the people of Florida.
What do you think about this idea, we got to get back to business in the next 2.5 weeks. The president talking about Easter. More voices, particularly, I think, among conservatives, not totally, but more among conservatives of we got to get back out there. This, if I have to give up my life, if I have to lay down my life to preserve the American economy, I guess I'm willing to do it. Well, as a public health matter, what do you think when you hear that?
I think this is a completely false choice, right? Like, this is not a your money or your life situation. This is I get it. Like, it's painful. People want to open up again. But here's the problem. We open up too soon. The virus doesn't care if you're a Democrat or Republican. The virus is going to run rampant. And what's going to happen is in 4 to 6 weeks, all the places that open up again will see this influx. Their hospitals are going to get shut down, and they are going to be in big trouble. And then we're going to have a national lockdown, and it's going to last much longer, and many more people are going to die. So even if you just care about the economy, this is a really bad idea. But we've just set up a false dichotomy of life versus economy. No, we've got to find a third way that allows the economy to function and save lives. And I think we can.
Yeah, we need to test and trace and implement a regime, something like what they've done in places like South Korea and Japan and other ways.
Exactly.
Dr. Ashish Jha, you've been a really important voice on this, so I really appreciate you coming. Please come back.
Thank you, Chris.